I've promised some of you another video on structural family systems with more of an emphasis on the interventions I might use. So I'm hoping that this video does the trick for you because I've got 10 structural interventions to share with you that I'm going to break down and describe. If we've not met before, my name is Oliver and I'm a family systems therapist here in Los Angeles. I'm a clinical supervisor and a clinical director. I ran a treatment center for teenagers for many years and built the entire program around the use of family systems theory. If you're new to working this way, there are some other videos on my channel you might want to check out. And the hub for all of this is mypeoplepatterns.com, and I'll put the links below. If you have questions about this video, please leave me a comment. I love hearing from you. Or if you have ideas for other videos, I am certainly open to hearing about them and trying to make them for you. For this video, we're going to be talking about the Smith family. Obviously, I can't and don't talk about my own clients. So this is a composite case. It's a mush-up of similar cases of my own or of people that I supervise. There's no identifiable information in here, but all of the dynamics are real. So we've got Dad, who's 42 and has been previously married. And his new wife, we'll call stepmom, is 30 years old. And they've got 3 kids living with them. Sophia is 15 and Dad's daughter from a previous marriage. She's the IP, the identified patient, because she's the one with the problems. Sophia has a 13-year-old sister, also from the previous marriage. And there's Ethan, who's 7, and the only child that comes from Dad and stepmom. Now, stepmom called me to make the appointment because she's concerned about Sophia, who is out of control. Her behaviors are more and more rebellious, and she's missing curfew and staying out later than she should be. I don't think you need too much background here, but sometimes it's helpful for context. So Dad was married in his 20s and had 2 kids, Sophia and Lily. And when that marriage ended, he moved back in with his parents and took full custody of the kids. He met stepmom, Ethan's mum, when she was 20, which is about 10 years ago. And that's when they got married. And that's when they actually first noticed some of the issues with Sophia, who sort of oscillated between loving and hating her stepmom. Recently, this has increased. She's become more rebellious, missing curfews, allegedly using drugs and potentially being sexually active, which is a concern. Stepmom and Dad disagree on these issues. Dad thinks it's normal, whereas stepmom is alarmed and also very angry at the disrespect. Biomom is completely out of the picture. The 2 girls have only seen her a couple of times since the divorce. They don't know all of the details about why it ended, which is also a source of contention between Dad and stepmom. All right, let me try and break this down. So step 1, hypothesis. Let's assume I got all of that information from stepmom and Dad before the first session. And you can get a similar amount of information if you do an intake call before your first session, or if you're at a clinic, you might get handed a file on the clients that you can review before your first session. And with that information, you can start getting an idea of what is going on in the family based only on that information. It's limited, but it is helpful. Structural family therapy believes that there is an ideal or a healthy way that a family should look, which sometimes gets people upset because it sounds like we're saying we're the experts on the family. And I'm actually not disagreeing, but we are kind of saying that, and we construct or co-construct what that looks like with each client. So it's not one size fits all. We do respect cultural and social differences, but we kind of do know what is best for the family. And ultimately, all that means for me, at least, is that parents are in charge. I am going to insist that parents are higher up in the hierarchy than kids. This is not healthy for anyone in the family, and especially the teenagers. Something like this is what we want the family to look like. So based on the information I got during the intake, I think something like this might be happening. The IP and stepmom have a lot of conflict, which is that squiggly line. The IP has too much power insofar as they're not respecting rules, they're not listening, and they think that they can do whatever they want. I'm not really sure where the hell Dad is at the moment, so he's off to the side, but probably he's I think that's probably right because he's not there to back his wife up. I'm not sure about the other kids yet either. In my first session, what I really want to do with the family is to get to know them. And that's what we call joining. And it's just a fancy way of saying shooting the shit. We're just going to chat nicely for them. Make sure you include everyone. Don't just stick to the talkative person. Get to know them. You've got this skill already because you're a therapist and you like people and you have good communication skills. So just chat. And while you're doing this, pay attention to what is going on in the room. Where do people sit? Who speaks first? Who stays quiet? Who looks angry? And all of this will either go to support your hypothesis or make you throw the hypothesis out the window and start again. Let me tell you what I saw and observed first in that. Let me tell you what I saw and observed in that first session. So stepmom did most of the talking. Dad was quiet, a little passive or removed. Sophia was moody and glared at me a lot, often not speaking, which made stepmom nudge her more to answer my questions. So not really any surprises, and this kind of confirms my initial map. The younger kids were a bit more involved, so I moved them around a bit. Dad got considerably smaller after our first. There's already a bunch of information here. The thing that I really want to do also in that first session is get everybody in the family on board with what the problem is. I want everyone to agree that the problem that we're dealing with is X. This is going to be so helpful to you because it's going to keep you focused. It will stop you from getting overwhelmed when the symptoms shift or they come in the following week talking about something completely different from the previous session. And it gets buy-in from the family. So I will go around each person in the room and ask them what the problem is in the family that they think I can help them with. Unfortunately, they are not all going to say Sophia's rebellious behaviors and argumentative nature. It just never works like that. So Lily might say something like, I wish things were calmer at home and there was less fighting. Great. Dad might say, I don't think that things are that bad. My wife makes a big deal out of everything, but that's between Sophia and her. I think our family's fine. So I might have to pull some ninja moves here and say, if Sophia and your wife got on better or Sophia's behaviors changed, what would be different? And he's basically got to say that things would be better if that happened. In which case, I could kind of nudge him towards saying that the issue is Sophia's behaviors. Once I've got everyone on board, I am going to use circular questioning to get into the real nitty-gritty of what happens in this family. In structural family systems, the symptoms are relationally driven. That means that no matter what the symptoms are, there's a pattern between other people in the family that goes on before and or after that makes the symptoms keep on happening. And there's a video and a mini course you can get on circular questioning if you're curious to learn more. It changed my life, so I highly recommend it. The most obvious circular question that I can think to ask here is what happens when Sophia breaks a rule or comes home late? Who does what? So I might ask that to the stepmother first. She might say, well, I try and address it, hoping she'd listen, but she becomes defensive and I feel like I'm the only one enforcing the boundaries, yada, yada, yada. Circular questioning is all about, and then what? I would say, where is your husband when you do this? Or I could ask Sophia, where is your dad when stepmom is reprimanding? And then I want to see what dad says. Dad, do you agree? Dad says something like, well, I try and stay out of it. It feels like sometimes she might be overreacting. Other times I kind of make things worse because she thinks I'm siding with Sophia. Then what happens? So I might ask stepmom again, after your husband stays out of it or takes Sophia's side, then what happens? And she might say that she gets frustrated or shuts down and retreats, avoids them, she tries to let the dust settle. My next question is going to be informed by the fact that I've got a bit of a hypothesis going on already, and the answers to my circular questioning are all kind of lining up with it. I want to involve everyone in the family, so my next question might be to Lily. Who deals with consequences in your household? Which of your parents is the easiest and which is the toughest? Ethan, do you agree with that? I probably find out that consequences are not really a thing in their house. And at best, they are inconsistent. So then I'd want to know how does conflict get resolved in your house? Who is the first to make up? Who is least likely to admit that they're wrong? So I'm scaling questions as well, put everyone on a scale. Again, there's more on this on my mini course, and there's another video about it too. The specific answers to this are less important, but the question itself is an intervention because it gets them thinking about the family as a system. Essentially, with that question, I'm getting them to think about the idea that if there are no consequences, then is it really any surprise that their eldest child is acting out? The circular questioning can help me get a bit of an idea of the pattern that goes around Sophia's behaviors. This is the goal of circular questioning in my mind. So Sophia acts out, stepmother tries to intervene, dad minimizes the stepmother's concerns, occasionally aligning with Sophia against stepmom. This results in stepmom getting frustrated and retreating and avoiding confrontation. And as a result, family issues remain unresolved. And all family members feel frustrated. There's no solution to anything and no consequences. So going back to my family map, my goals are to get the family from looking like this to this, right? How am I going to do that is basically the goals of treatment. So I identified a few. I'm going to strengthen that marital subsystem. I'm going to work on helping the parents collaborate effectively. And that means everything from consistent boundaries or ensuring that they're aligned in their approach and not being split up. I need to detriangulate Sophia from the marital subsystem. So this is linked to the previous goal because dad is the peacekeeper between his wife and his daughter, and that's a triangle. Now, if dad and his wife were on the same page, there wouldn't be any need for a triangle. So all of this is to do with stepmom and stepdad not being on the same page, and I really need to get into that with them. I also want to change that dynamic between Sophia and her stepmom. The therapy is my interventions are going to help them try and build a better relationship. So that involves creating opportunities for bonding, working through conflict, just feeling closer in general. I don't want them to be oppositional anymore. I've definitely got to deal with communication, right? Bring the family closer together, get mum and dad on the same page. So I'm going to try and think about how I'm going to bring stepmom and dad closer together, and that will help solidify the boundaries. Ultimately, I've got to help the family, help shape Sophia's decisions and behaviors. So that comes from boundaries and hierarchy. So it's all interlinked. That was a lot of me talking already just to get to this bit, the interventions. So we've actually already discussed some of them. So I'll review those and then add some more specific ones that I might implement after session 1 or 2. So the first intervention that we've already discussed is joining with the family. It's an intervention. You're building rapport, you're building trust, you're creating that safe space. You get to know your clients a bit better, and I think you lower their anxiety. So this is all about the therapeutic alliance. Getting buy-in. And that's as easy as saying, I want to get to know each of you a bit better. Tell me about your day. Tell me about your hobbies. What do you enjoy doing? The next intervention was about clarifying the problem. So I've got to understand the family's concerns about the perspective, not just the person who calls. The person who calls often has a narrative or a script. And I want to make sure that I understand it, not what they want me to think. I ask everyone in the room, let's talk about what brought you here. I'd like to hear from each of you about the problem you think is going on in the family that you need my help with. I want to pay attention to agreements and disagreements and ultimately get the whole family to agree on it. It also helps get buy-in from people and everyone working together. Circular questioning is also an intervention. That's all about trying to understand this pattern of interconnectedness. And I think I said earlier that even circular questions in itself plant the seed that it isn't just Sophia with the problem, it's a family problem. And that ties into my next intervention, which is reframing. So I want to provide a different perspective on what the family thinks the problem is. And again, this is about shifting them into systemic thinking, making them understand that perhaps it's not just Sophia that's got the problem, it's the whole family. And everybody needs to change, or at least everybody needs to work together to help Sophia. Now, Sophia will, in all likelihood, roll her eyes and loathe me for even saying that, and we'll come back to it in a second. But at least it gets mum and dad thinking. I might also say, Sophia, perhaps you could consider that your stepmom is not being confrontational, but she's being protective. So these are all about planting seeds. And I don't really expect much to change after that, other than to get them thinking. One of the big ones is strengthening that marital subsystem. I've really got to help parents collaborate effectively in setting boundaries and addressing all of the family issues. They have to be on the same page in some regards. And I would have them do this in a session. I would like both of you now to talk about what time you think curfew should be and what the consequences are if she misses it. I'm going to do that because I want them to have the conversation in front of me so I can see what goes on. And it may sometimes be as simple as they've never done this. So it might go quickly, it might not go quickly. If it doesn't get done in that session, it's a homework assignment for the parents and they have to come back and tell me about it the next week. And I don't know if this is helpful, but I would be looking for a curfew that is age appropriate. I would be looking for a curfew that is different at the weekend and a curfew that is different when there's no school. I want them to be thinking about all of the different things and there being a very clear set of rules about it, because otherwise the teenager, Sophia, is going to find holes in it. So it's really important that mum and dad are thorough and specific with this. And I also want age-appropriate consequences that hurt, which sounds pretty gruesome of me, but you have to know the teenager's pain point. Otherwise, there's no point in doing it. It's usually always phone or video games or hanging out with friends or banning sleepovers. It's got to be something that really motivates the teen not to do something. I also really want to strengthen that stepmother-daughter relationship. And I'm going to do that in a couple of different ways. One way I'm going to do that is by blocking or restraining her from being the bad cop. So, stepmom, I want you to take the week off from being the deputy of this family. And dad, I'd like you to step into that role for now. I think your wife is exhausted from all that parenting and she needs a break. Do you think you could do that for a week? That intervention is all about breaking the cycle in a very obvious manner. I want to shake up roles and rules. The thing about homework in general, I should say, is that they'll either do it or they won't. And it will work or it won't. But regardless, you always have more information to build your hypothesis on, revise it, change it, and make new interventions from it. With this one, we want to stop mum from being in that role. A role just means that you're being typecast into that bad cop routine, and we want to change it. And we do that because we know or believe that once you can shake things up and knock the structure down again, we believe that the family will be able to rebuild itself in a much more healthier way. I want dad to step into the role of being, dad more. So he's got to address the problems with his daughter. And I have a very specific idea for this. I want dad to write down all of the rules that Sophia breaks this week and come to the next session with a full list. This is a bit of a paradoxical intervention for Sophia, because if she's oppositional, she will want to prove me wrong, and she will be on her best behavior all week so that dad doesn't come in with a list of anything to whine at me about. And that would be a win for me and the entire family. So if she doesn't follow the rules and she still continues this behavior, she's kind of agreeing with me that she does this to bring her family closer. And I get to look at what went on with dad during the week that he couldn't set limits or impose consequences. That's also a win for me and the family. Blocking stepmom from being bad cop, making dad be more of the bad cop is helpful, but I would also pad it a little bit more to make sure that stepmom still had a bit of a job. Now, if possible, I want everyone in the family to have a piece of the homework, but stepmom would have a very specific homework of catching Sophia being good. She has to find one thing each day to praise Sophia about, no matter how big or small. That's all about boosting Sophia's self-esteem, encouraging more positive behaviors, and just changing the vibe of the house. I think we all get caught up in addressing what's wrong. So let's make an effort, stepmom, to catch Sophia being good. So write her a post-it note at the end of every day, acknowledging any small effort that you've seen her make. Praise her for it. Do you think you could do that for me this week? As Sophia receives more positive feedback and recognition for her good behaviors, we're reinforcing them and hopefully encouraging more of them. It also helps build more of a positive, encouraging atmosphere in the family, right? At the moment, it's all focused on Sophia being the problem, being the IP. At some point in the future, I'm going to ask Sophia and her stepmom to plan a little date together. I want them to go get their nails done or go see a movie together, just the two of them, no talking about any hot button items, just fun. So I would get them to maybe start a project or share a hobby together. I want them to find a way to better understand each other and connect in a way that isn't about rules and punishment. We want to strengthen that relationship to make it less combative. And finally, number 10 is my house meeting. It's my go-to intervention, and it's just this great system to put in place for family members to discuss on a weekly basis their concerns, issues, foster more understanding. It gives mum and dad the chance to remind kids what the rules are and what the consequences are. I've got another video on this house meeting idea that goes into much more detail of it, but it's really, really easy to implement. It's a really easy ask, and it really does work. I think, in work and jobs, we constantly get sucked into meetings to discuss where we're going and what we're doing, but we never do it as a family. So it's a no-brainer. It helps mum and dad reinforce boundaries. It helps them appear as a united front and to listen to what's going on with all of their kids. So I recommend this is a specific time each week for the whole family. It's non-negotiable. There's a format where I get everybody to share something positive, share some gratitude, ask for what they need and want. I'll put the link below. It's a good one. And again, that is all about bringing this family closer together. They're too distant at the moment, and that's where some of the dysfunction comes from too. Those were 10 structural interventions. Let me know if you want more. Let me know if you would change any of them or add any of them. Let me know if you think that would work. I'd love to hear from you.